Welcome to Nursing Stories from the Heart. My name is Beth Matarasso and I'm joined by my friend and nursing colleague, Cheryl Burns. Together we acknowledge the traditional owners of the lands and waters from which we're speaking, the Turrbal and the Yuggera peoples, and we offer our respects to their elders past and present. As you listen to Nursing Stories from the Heart, we hope you'll be inspired to tell your stories too, because we know you have them. Welcome to Nursing Stories from the Heart. Cheryl, you're reading to us from your memoirs of a matron. What story are you sharing with us today?
I'm sharing a story about the circle of life. So I'll begin.
Yeah, thank you.
Thank you. I had the privilege of contributing to the care of my beautiful aunt. She was beginning to enter the last phase of her wonderful long life. Her healthcare team decided that she would benefit from being on a palliative care pathway. I visited her on this day. A nurse came into the room and explained that she was the palliative care nurse practitioner. My eyes lit up. As she talked to my aunt's family and to my aunt, I was in awe of her genuine empathy, professionalism, compassion, advanced knowledge, and the confidence she showed my aunt and her immediate family as she explained my aunt's treatment pathway. On that day, only I knew that I was so proud to be a member of this profession we call nursing. I thought about how we, as courageous leaders and pioneers who believed in this position so much, had fought so hard for its fruition. To see it in the making was just a miracle of the circle of life. And my aunt, I actually talked to my aunt about it on that day, and she was so proud.
Yeah.
Yeah.
Proud of you?
Proud of the profession and proud to be involved on her last day of her life.
Yeah.
Yeah.
Yeah. Because I know that you were a part of a group of people who advocating for nurse practitioners, and you're going to talk to us about that. But if we can just talk a little bit about, I'm curious, did you have to advocate for your aunt to have palliative care? Or was that
No. It was offered, which I thought was amazing.
Yeah.
Yeah, and sometimes you do have to advocate because I mean, as we do in our practice, sometimes we advocate for the palliative care pathway to be implemented.
Yeah, because sometimes within the hospital system, people can be just sort of roll along with interventions, or whether that be imaging, or when something that's in the room is that this is a person who is living at the end of their life.
Yeah.
My experience has been that it's not always effortless to have palliative care be the people leading the care of the person at the end of their life.
Well, I guess it's quite really, I guess the word probably, it's quite confronting sometimes for people to say, well, I need palliative care, or maybe palliative care is the option. It's actually a point in time in your life that's quite amazing, really. You think about it.
Yeah, and it just brings to my mind the importance of, statements of choices, advanced care planning.
Absolutely.
Those types of, for want of a better word, processes that we have for us to be thinking about that, because I think it's not easy for a person who is living at the end of their life to advocate for themselves for palliative care, because particularly, and we talked about this in one of the earlier stories, the system of healthcare, it's complex. And I think that people have, if you go to hospital, then you're going to get better, or there's cure. And you just mentioned what I'll call death anxiety. You didn't use those words, but I'm not sure how free we are to talk about dying, and yet it's critical. And it is coming for us all in some way.
Absolutely. So the setting my aunt was in a nursing home, but there was a link to the hospital.
Okay, yeah.
Which was, I think that model of care is amazing. And there was a very close link, so that they actually come into the nursing home.
Yeah.
Yeah, I thought that was an amazing model of care.
Yeah.
And I would hope that there's many out there now.
And I think that for stories, for people who have, and remembering that there are stories that are occurring for the person and their significant others, there's a story that's unfolding for them and the experiences they're having. And then there's a story for nurses, other health professionals too, but we're talking about nurses, for the nurses who are involved in that. And your person in the story, so the nurse practitioner in your story, seemed to be somebody who was confident, as nurse practitioners are. I mean, they're advanced practice nurses. They have quite a lot of authority within that space.
Well, they have autonomy, don't they?
Yes, that's the word I was
autonomy.
looking for.
I've actually, if you like, I've actually written about it in my book. If you'd like me to share that.
Yeah, please do. Yeah.
Okay. I believe we should have thousands of nurse practitioners in Australia.
Mm-hmm.
We don't actually. It's just it's still just trickling away, but we should actually have a big major change within the Australian health system and have thousands of them.
Mm-hmm.
So I've written, there's so much work to be done in providing healthcare and so much should be shared among all professions. The nurse practitioners must be at the forefront of health decision making. I recall when we first introduced nurse practitioners into Queensland. The work occurred at the federal level for them to be credentialed. We were so excited. So much work for so many years had come to fruition. It was such a turning point in our profession. We established a statewide committee with all stakeholders involved, including members of the AMA. And they were very, very good on that committee. I must admit they were very interested and very supportive, which I actually acknowledge. When we, the senior nurses of Queensland, launched the role, a state member of Parliament, who was a nurse, scheduled a press conference. Guess who the group chose to be the spokesperson of the group? You guessed right.
Burnsy.
We had our script ready. Actually, it was quite an interesting time. So what I said was, a nurse practitioner is not a doctor. A nurse practitioner is an independent, highly educated, qualified, experienced and credentialed health professional. A nurse practitioner provides patient-centred holistic care. That is the high level of nursing care, the ability to prescribe medications, the ability to prescribe pathology and also X-ray requests, and the ability to refer to another health professional. When we mention holistic care, as we've mentioned in our previous podcast, Beth, that's all the psychosocial elements of care as well the nurse practitioner provides, which is the icing on the cake. And so that was that. Yeah, so I guess that the nurse practitioner is at that high level of advanced practice that we have in our career structure in nursing. But also, all nurses have their scope of practice, and the scope of practice of a clinical nurse consultant is at that advanced level, but they haven't got that, they haven't got that regulation as a nurse practitioner.
Yeah. So I'm just dragging back from my memory. For a nurse to be practice to be considered advanced practice. From memory, it's the incorporation of like a number of elements. I think professional leadership, education, research, and
many years in their clinical specialty.
Yes, there's a fourth one that's gone from me, but it's a demonstration of those elements within practice. So it's not a job title.
No.
And it's not something that would be in remuneration. But are you saying that it is working at the top of scope? So if I'm a registered nurse, I'm working clinical nurse probably in the community, but I can be working at advanced practice level because I am working to my full scope?
Yes.
So that would, okay.
Yeah. Absolutely.
Okay.
But we need to really, this is actually could be another nursing story, because we need to talk about this.
Mm-hmm.
We need to advocate for this full, utilising the full scope of practice of nurses, because it's actually quite amazing.
It's just come to me that fourth one is supporter systems. You've talked about it as a career option for nurses, and I think it's exciting and inspiring. What is for the person receiving care, Why is it so important for that person and their family? How is it different?
You mean the nurse practitioner?
Yeah.
Yeah.
What is it?
Well, it's virtually a one-stop shop. I mean, the nurse practitioner can actually provide all aspects of care for that patient.
Okay.
All aspects of care.
Okay.
Not just the clinical aspects or the prescribing to protocols or those aspects, but also the empathy, the compassion, all those elements of nursing care that people need at their end of life, and also the family, providing it's for the family as well. They actually work very, very hard to work with the family, which I observed with my aunt.
We're talking about stories, and interestingly, one of the things that people often say when they are within the healthcare system receiving care is that they have to keep telling their story, and it's probably a time when a story isn't felt so favourably. And when I'm listening to you talking about the nurse practitioner and the things that a nurse practitioner is able to do, then a family and that person themselves doesn't need to keep retelling their story to multiple people.
That's that single point of contact, and that person will be coordinating the care.
Yeah.
Yeah. Of course, they'll be, liaising with the medical officer, etc., and all that stuff. But that person has got the ability and the credentialing to fulfil that role. Yeah.
I think you were going to share another story with us that was about compassion from memory, and I was having a look at the word compassion, and I think it is from the maybe from the French or the Latin, and I'm not going to remember that word, but I liked to see it was about suffering with. That's at the root of the word. And when I read your story, I think the one you're going to read us, it really resonated with me about that suffering with.
Yes, well, it's a story of compassion. I admitted a middle-aged woman with suspected myocardial infarction, which is a heart attack. Her family were with her and were very, very concerned, and I could pick up that this was a very, very connected family. They adored their mum, and they were very, very worried about her. So I guess, so the team were working hard to stabilise her with medications, monitoring, etc. She seemed to settle for a while, and then suddenly she went into rapid ventricular tachycardia, which is a serious arrhythmia which can occur when a person is having a heart attack. We asked the family to leave. They didn't really want to leave their dear mum, and I could see the wonderful connection they had even then again. We commenced treatment for her ventricular tachycardia. However, she didn't respond as well as was expected. We continued to monitor and treat her, and of course, by that stage we had a team, the team around us to help with her resuscitation. I stayed at the head of the patient. She whispered to me that she wished to see her children. I asked the head of the team, who said, "Not really at this time." I asked again in a moment. The answer was yes. I went and got each of the children to be with her, explained to them the seriousness of their mum's condition, and described what would be happening as the team were providing care to their mum. I suggested that they whisper in her ear what they wished to say to her. The team continued to work on her. She was fading. However, as we know, hearing still occurs even when a person is at their end of their life. Each child came in and spoke with their mum. Sadly, she passed, and the team ceased all care. Of course, they were all very distressed. However, they were so grateful that they had spent those last few moments with their precious dear mother. It was really something that I've never forgotten, actually.
It's beautiful. And I particularly like the when you asked the first time, that response jumped out to me when I read it, that it wasn't no, that there was that other person in the room was willing and present, and it was, I think, not really at this time, but it's certainly, and we've talked about your courage before and your advocacy, but it was certainly left that door open for that question
Yeah.
to be asked again.
Yeah,
And I
yeah,
think we talked about intuition previously before, that you would have had a sense of now is the moment for that.
Exactly.
Yeah.
Yeah.
Of course, another thing that strikes me about it is the stories that family tell, because they will tell stories about that. Well, it was their mother, that person in their life who has died, and I love to know that they will tell a story about a nurse who made that possible for them, that they had those moments and that connection. What a comfort to a family.
Well, I always, and I'm sure most nurses do, put themselves in the patient and family's position. What would I expect? How would I want to be treated? You know, it's so important that we do that as nurses.
Yeah,
I know it happens probably every minute of every day.
Yeah.
There's so many interactions happening. But end-of-life care is something that we as nurses really lead. You think about it.
Yeah.
We lead it. The medical officers, of course, accountable for the patient's, episode of care, but the nurses lead end-of-life care. It's one of our special things that we do.
Yeah, and we have talked also previously about the intimacy of nursing, and I think it's a hallmark of these moments that nurses share with people and families as life is ending.
I think the other thing too, our novice practitioners are very vulnerable during this time, and we must support them, embrace them, console them, because that first time that you actually involved in the end of life of another human being as a nurse is actually quite thought-provoking. And, we all remember the first time we're involved in that. Yeah.
And I think there's a story that you have in there that is about a person whose life ends in ICU, and you... Again, I sort of think in pictures a lot, but I see you representing the nurse as slowing everything down. The busyness, there's pressure. We know that in parallel with the sacredness of a life ending is a system that's, that keeps on moving. But in your story that you tell in ICU, I have that picture of it just all being slowed down.
Yeah.
We've got time, and there's a dignity about it. There's a courage and a dignity and a gentleness about just saying, we don't need to be in a rush here. There's somebody's life has ended, and it's sacred. Do you know the story that I'm talking about?
If I could just, I'll lead into that. If I could
please,
just read a little bit more. We've just to round that up. I'll just read what I've written here. At all times when a patient has passed, the nurse must take leadership role in processing, in the process in whichever setting. I see that as one of the most important roles we as nurses play, as these memories are lasting for life. And I believe we can assist the grieving process of families in so many ways. If that time is actually, as you said, slowed down and nurtured and embraced, so that the patient and the family actually are both getting the best out of that whole very, very sad process. We were in all deaths, it's essential that the body is washed and clean linen is used. The patient's presentation is so important. Little things like having their hair done, their teeth, their shave if necessary, their hands placed outside the sheet whilst the patient is in the supine position. It's also important that the environment is clean and tidy. It must be a calm environment. And if the environment is untidy, it's not calm. The patient remains the centre and is treated with the utmost respect and dignity through this process. Now that there are many different nationalities, it's essential that the patient's and family wishes are met according to their traditions. I recall a patient who passed away whilst I was working in intensive care. This must be the one you're talking about. Okay. And the family stayed with their loved one the entire day. They brought in food, had music, and were all with their loved one for one more time. I stood firm when asked about when the bed would be empty. When the family are ready to finally say goodbye to their loved one, I said, and I never wavered. These types of experiences never leave you as a nurse. So that's so important that we advocate for the patient even at that end of life.
And I think when you started this, you were saying about for the nurse, the novice nurse, or the nurse who has not been in a situation where someone's life is ending, that type of, I'm going to call it a ritual, but that slowing down, I think to have, you talked about bringing those nurses along, if they can participate in that, see that and feel that, what a gift for them to help them to process and think and reflect and to feel that, and to know that it is part of what a nurse does. I think it's a beautiful story.
Yeah, and I think it's so important that we must embrace those novice practitioners by allowing them time to process all that. Maybe through mentorship, through reflective practice, but giving them time. The busyness of these places now is something that we need to slow down to allow time for these people to have that time for reflective practice.
Because when you said about the bed, it's such a clanging sound to me, and yet I know it is the business, for want of a better word, but when you hear it said against the life of a person that has ended, it's quite a clash. Yeah.
The bed's nothing, really.
It's nothing. It's nothing
compared to the richness that family received by allowing. That's what they wanted. Yeah. And a lot of people actually in this day and age, they want that. Yeah. So we as professionals need to meet those needs.
Facilitate it.
Yeah. Thanks,
it's beautiful. It's beautiful. Well, thanks, Cheryl. That's given us a lot to think about as always. And until next time, when you'll be sharing a story with us about hope. This has been Nursing Stories from the Heart. Thank you for being with us today. And until next time, this is Beth, and you've been listening to Nursing Stories from the Heart.
And this is Bernsey from Our Hearts to Yours. We encourage you to share this podcast with your colleagues and friends, and we hope you enjoy them.
Do you want to tell them about your book?
Yeah, I'll tell them about the book. If you are finding value in these stories, and if you want to explore the history of my story, you can find my book, Memoirs of a Matron, in a bookshop. Your support helps us continue sharing these stories. I didn't really write the book to sell books. I wrote the book to tell my story and to let you listen to them.
And it's a great tale.
Thank you.